Everyone. My name is Joanna Cohn. I'm director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. And it is my distinct pleasure today to introduce our speaker for our Innovations in Tobacco Control seminar, Dr. Joseph Lee. Now, Dr. Lee's research focuses on the retail environment and LGBT health inequities, but he has also studied a broad range of tobacco prevention and control issues that address every letter of Empower. Dr. Lee did his MPH in maternal and child health and then a PhD in health behavior at the UNC Gillings School of Public Health in Chapel Hill, North Carolina. And he is a true academic superstar. He has over 110 peer-reviewed publications with about 45 as first author and another 14 or so led by students that he has supervised. And since completing his PhD in 2015, he accepted a faculty position in the Department of Health Education and Promotion in the College of Health and Human Performance at East Carolina University. That was in 2015, and only 4 years later, in 2019, he was promoted to associate professor. And since then, he's been tapped for his leadership skills. He was assistant chair of his department for a year, but then was asked to be interim director of the School of Social Work for a year. And then last year, he was appointed as Associate Dean for Research for the College of Health and Human Performance, which is fantastic. Dr. Lee wears many hats, as you can see, but he is with us today as a tobacco control policy researcher. And he's going to share his expertise with us on the role of tobacco retailer proximity and density on adult smoking and health outcomes. So I'm really excited to welcome Dr. Lee, and there should be a Q&A box. Oh yes, we have one. So please put in your questions, and Dr. Lee has said that he'll leave enough time for questions at the end. So Joseph Lee, thanks so much for joining us, and over to you.
I really appreciate it. Thank you so much for the kind introduction, which made me feel a little bit tired there thinking about all of that. But I'm excited to be here with you all today. And I'm going to be giving you a bit of a whirlwind tour of what we know about the relationship between tobacco retailer proximity and density to adult tobacco use behaviors, and a little bit about health outcomes as well. So this research comes out of a National Cancer Institute award, and I also have a royalty interest in software about tobacco retailers, but that was not used in this particular subject. And what I really want to do is highlight all of the other folks involved in this effort. So what I'm going to present to you is a meta-analysis and some of the theoretical framing and background that led up to it. But I really owe a lot of credit to this wonderful team of researchers at UNC and Stanford and Washington University in St. Louis and East Carolina University here, who helped to make all of this possible and lent me slides and all kinds of other things. So many thanks to all of them. And I'm going to sort of really try to hone in on what is the evidence that we have at this point in time regarding tobacco retailer density and behavior. And the reason for this interest and this focus is that I think this is an area globally, certainly in the United States and in many other countries, where there's a lot of room to focus in on our policy efforts and policy change efforts. And we should be able to, especially in the context of endgames in many countries around the world, think about how to reduce the ubiquity and presence and easy accessibility of tobacco through retailers. And as I'm going to talk to you a little bit later on, I mean, the retail environment is about so many other kind of pieces that influence health behavior and that are in turn influenced by tobacco manufacturers. So hopefully by the end of this 45-minute or so talk, you're going to have a really sort of good idea of kind of where the literature is regarding this topic. So I just want to ground all of us in where I'm coming from. So I'm a US-based researcher in the state of North Carolina, which is a major producer of both tobacco and has several cigarette manufacturers located here. And when I think about the retail environment, I'm really thinking in this US context, and we can unpackage this a little bit for other countries as we go forward. But I'm thinking about sort of the marketing of these products being front and center when you go up to a gas station or a convenience store, and that being really visible along with price promotions. And I'm thinking that inside many tobacco retailers in the United States, and I know many countries have much more stringent protective regulations around this, but you can see all of our cigarette products, you can see our discounted prices, you can see advertisements, and you get what is effectively this power wall of tobacco products, like framing behind the clerk. And this happens in pharmacies, in gas stations, and so many other locations here. So as you're thinking about this idea of retailer density, it's not just that there are retailers in a spot, but it's also what products do they have, what marketing do they have, and all of those kind of pieces. So just to give you a little bit more on sort of the scope of this and think about it in our classic American kind of way, there are about 31 tobacco retailers for every McDonald's location in the United States. So a very ubiquitous product, a very ubiquitous sale of product in retailers across the country. Combine that with a lot of spending in the US, over $1 million an hour on promotions, discounts, and advertising in the US by tobacco manufacturers. And you get sort of the presence of a product that's being promoted in a very common retail environment, so across the country. So we're trying to operationalize this and think about this in ways that can inform policy decisions and inform what we think will be the impact of those decisions at all our different layers of government here. And so one of the pieces here that I just want to sort of walk you through is how we're thinking about tobacco retailer density. That is the availability of tobacco retailers in a geographic area. So let me just walk you through kind of our thinking. Think of this box as a neighborhood, and each of these little smoking symbols as retailers. And there's different ways to think about what does tobacco retailer density mean. So we can think about it in terms of how many retailers there are per 1,000 people. So are there more retailers per person in one area than another? We can also think about it in terms of the land area of how many retailers are there per sort of area unit, square mile here, square kilometer, acres, and beyond. Or we can think about it, how many retailers are there per kilometer of roadway? And so all of those are kind of different pieces going into that we're kind of trying to pull together and look through in the work we've been doing. But all of them represent this kind of idea of tobacco retailer density. So when I'm talking about tobacco retailer density, I hope this gives you a little bit of a sense of sort of how that's being operationalized across the studies that we're then taking and trying to pull together in a meta-analysis. The other kind of thing I want to highlight is going to be tobacco retailer proximity. And we think about this as the distance to a tobacco retailer, how close it is to your residence, your work. And so people will measure these by roadway or straight line distances or many other ways, but at its simplest, this is how many feet or how many meters are between where you're spending time and the nearest retailer. The idea being a closer retailer is easier to get to, you're more likely to see, and so on. So it should, in theory, influence health, which is where I want to take us next. So step back from the kind of the raw epidemiology of meta-analysis of pulling the numbers together, and let's think briefly about why we should care about tobacco retailer density and proximity. And fully acknowledge and want you all to know that there's many ways to think about this, but I want to at least sort of give you a couple ways that sort of drive some of how I'm thinking of it. So one piece, of course, is that we're all in this social ecological framework, and every person is nested within their family and community and the healthcare environment and the organizations, and importantly, the neighborhood or place and spaces that they occupy. And that's kind of where I want to focus in our attention, is on this idea of the place and space where folks are. So if you draw on a Bernard framework of health inequalities, then kind of focuses us in on there being kind of a social angle of thinking about this and a physical angle. And we can also break those down a little further into an economic dimensions of this. So when we think about tobacco retailers, we're thinking about exposure to tobacco retailers based on how they physically are present in one's environment. We're thinking about the sales, the promotions, the discounts. We're thinking about the volume of marketing that's present there. And we're also thinking about how retailers, their presence, and the products that they are selling set some social norms around what's acceptable, what's normative, what is a normal product, like bread and candy bars or whatever else. Oh, goodness. So as I try to think about these, like really sort of setting down like why tobacco retailers, and thinking from that neighborhood effects kind of, some of the neighborhood effects kind of literature, and diving in a little bit, I really think we come up with like 4 kind of buckets or domains of reasons why we should be caring about tobacco retailer density and proximity. I want to just spend a little bit of time here before I get any further, just reminding you all and talking through some of this, of why we think it matters. So certainly tobacco retailer density in theory should mean one is getting more exposure. As there's more tobacco retailers around you or near you, one should be getting more exposure to tobacco retailers in a sort of a classic epidemiology kind of way. And in doing so, one may be getting more nudges to purchase products, more marketing to change norms and desires and recruit new product users, and one is exposed to different sort of profiles of products and more products, especially in places where marketing has already been restricted. You can think in sort of an economic way that this is also about search costs and the travel cost it takes to get to a product. If you want to get a new pack of cigarettes, like, is it, a 2-minute walk down the road, or is it a much further kind of process or ordeal to get? And that plays into people's health behaviors. We certainly have lots of evidence of that. And another thing that plays into health behaviors is really price. And retailers are a really important location, especially in the US, for where there are special offers and price discounts. And that is exposure to those and the cues to change one's behavior based on pricing. And finally, as I mentioned earlier, the other way to think about this, I think, is that there are norms around what is a product that's just kind of an everyday product rather than a leading cause of preventable death. And does that change how socially acceptable that is and what it means to be seen using it? So not probably the most sophisticated of theoretical frameworks out there, but do want to kind of call your attention to the sort of underlying behavioral economic theories about why we should care about this and why it makes sense that we should be interested in documenting the role of retailer density and proximity on health behaviors. Now, I also want to make the case to you that these things don't just exist because of retailer behavior, but if you think about the role of tobacco manufacturers, then we can also say that there is a role of the manufacturer in working with retailers on what products, marketing, nudges, pricing, and even communications from clerks to customers are happening. And I point this out because we've recently published a new look at the often secret contracts between tobacco manufacturers and retailers from around the globe. And in this, we see at the end, the tobacco manufacturers play a really important role in determining what marketing people see, what products people see, what prices people pay, and even what communications clerks give to customers. And so that sometimes in their contracts, clerks should be recommending a specific product or like providing specific information. So I don't want to lose sight of the fact that, yes, I'm talking about retailers and built environment, but there are important underlying and often secret forces changing what's in neighborhoods and what consumers are experiencing in the retail environment. So I hope you check this out. I think we're really proud of this paper, and it's a really interesting read to see what's been revealed in some of these retailer to manufacturer contracts. And I won't walk you through all of this, but that paper also includes kind of a model of thinking about how contracts with retailers influence the retail environment, the consumer experience, and ultimately behavior. So another kind of angle of thinking about why all of this matters and why we should be caring about the retail environment. So I'm now going to kind of switch gears a little bit, and I'm going to take you through a meta-analysis that I led looking at what's there in the literature on tobacco retailer density and proximity in relation to health behaviors and outcomes among adults. So like all classic proper systematic reviews and meta-analyses, we started with systematic searching across multiple databases, and independent coders reviewed each title and abstract, and then independent coders reviewed each full text article. And we kind of sorted all these through and ended up with 37 papers from the literature directly about individuals, adult individuals, exposure to tobacco retailer density or proximity, and their health behaviors or health outcomes associated with that exposure. So this is not ecological studies. This is really focused in on studies with individual people where we're measuring density or proximity and a health behavior or outcome. And we were able to statistically combine 27 of those in a more formal meta-analysis. Just to give you a flavor for the kind of details, and if you want all of the gory details, like please, our evidence table of all of these studies, all of their findings and the details of them is available. It's linked in the published paper and is available publicly to everyone in the ECU Dataverse. So I'm going to talk about a meta-analysis where we've tried to statistically combine all of these results. And next I'll talk a little bit about some of the challenges of doing that. But first, let me talk to you about the metric we used. So we have taken this heterogeneous, diverse literature from around the world, and we've had to try to convert everything into sort of a more standardized effect size. And we have chosen to do that in a relative risk reduction. So all of my results are going to be presented as a relative risk reduction. And the conceptual idea here of a relative risk reduction is that if we took away the exposure, so if we took away the excess density or proximity, then how much would that reduce the likelihood of the outcome? So if we conceptually, if we took away the density exposure that people had, what would that do to their likelihood of smoking? And that's kind of this metric that I'm using throughout this. When you see relative risk reduction, just wanted to make sure that that's kind of, it's not used commonly in meta-analyses, although it has a history there, but we chose it for this conceptual piece of what happens if we get rid of this excess exposure. So as you all may know, meta-analyses are really designed and really came out of a field of looking at clinical interventions in psychology and medicine. And the goal is typically to take the most similar interventions, or nowadays the most similar drug trials, put them together and try to get a better, more stable estimate of what that would look, what the true, if you will, effect size is. But what I'm doing here is a meta-analysis of observational studies that measure things somewhat differently in different contexts and in different environments and with different ways of measuring both behaviors and tobacco retailer density. If any of you have done a meta-analysis, I know right now you're feeling sorry for me because there's just so much going on. And one of the things sort of in meta-analysis folks like is that everything be kind of the same. So you're combining stuff that's the same. So we understood that this was a challenge with this literature. And we took it on saying, like, there is all this heterogeneity, there's all this difference and different things going on in this literature, but can we look and explore how the differences in the literature influence the outcome? And so that's what we've tried to do, is leverage all of that heterogeneity or all that difference into sort of clues about what matters, clues about the relationship and role and when density and proximity matter to health behaviors and outcomes. So we took that approach in 3 ways. We did a random effects meta-analysis to try to take some of that heterogeneity into account. And then we did separate meta-analyses by different study characteristics. And then we did a meta-regression where we statistically predicted the effect size based on the characteristics of the study. I know I just threw a whole lot at you and I apologize, but I think that will be a little clearer as we move forward. But just wanted to sort of put that in context methodologically, that we recognize there's a lot of difference in these studies, and we've tried to take that into account and look at the different ways studies have been operationalized, and that will show up in the results. Okay, so let's just start here sort of globally. If you look across all of these behavioral outcomes, we see an estimated relative risk reduction of 2.48. So that means, sort of thinking about this in the average study for the average outcome, that if we eliminated the tobacco retailer density as it was being measured in the studies, then we would see a 2.5% reduction in the behavioral outcomes as they're measured in the study. So for example, if we reduced the amount of tobacco retailer density, we would expect to see about a 2.5% reduction in smoking. That's one way to think about it, sort of in a more concrete example. That's sort of consistent with the theoretical kind of piece I've presented already, that retailer density matters to behavior and should be associated where there's more density, there should be more likelihood of smoking for individuals. So we see that's consistent across all of our pieces of our meta-analysis. And when we look at the different types of behavioral outcomes, for smoking, for example, we see a 2% decrease for quitting, 6.5%. Relapse and young adult initiation didn't show up very strong and also had many fewer studies involved. And other kind of stages of change or other measures of behavioral outcomes. So I think what you're seeing here is a consistent pattern for the things that matter most of there being a positive relationship between density and tobacco use behaviors. So consistent with the theories, but you also see there's some variability in what we're finding based on, are we looking at smoking, are we looking at quitting? And we also see in the same direction, but a quite small effect size, recognizing, of course, it's an average across a bunch of different types of studies for health outcomes. So the evidence there, not as compelling based on the existing literature, but still a pattern of If you do the meta-analysis overall, we see what we expect to see. And if you do the meta-analysis just for the studies of smoking or just for the studies of quitting, you see the same kind of pattern. So let's disaggregate that a little bit. Sorry, let's think about that in terms of density. And then I'm going to talk about proximity. So that was kind of the biggest, most global kind of look. And now we're going to talk a little bit about density. So just to orient you to this forest plot, each row or each sort of bar is a different study. And this is the sort of pooled effect of the results about density from that study. So there's 182 effect sizes or results reported in this, and they're reported across these 25 studies. And everything to the right of the zero line in the center suggests that reducing the amount of density would improve public health. So this idea that if we use thinking of this as a relative risk reduction, if we remove the exposure, the way it's measured in the studies, we would expect to see improved outcomes around health behaviors. So less smoking, for example. And yeah, you can see that kind of pattern of, to me, the evidence is leaning in that direction here, as well as what I've just shown you in the prior slide of looking at the actual kind of meta-analysis results. So sorry, let me say that slightly differently. So looking at all types of density, we see a similar relative risk reduction. And again, this is me stratifying, giving you different meta-analyses by different study characteristics. So all density studies, same kind of pattern, 2.5% relative risk reduction. If we measure density in different ways, as I mentioned earlier, when we're looking at the box of neighborhoods and the count and the land area and per persons and other more creative ways that are out there, we see also sort of the same direction of results. And they go up and down by a couple of points there, but I also think you have to think about how they're operationalized. And in a linear regression model, if a 1 unit increase is associated with an outcome, then the definitions of 1 unit increase sort of can be kind of different across these. And so I think that's consistent. We're kind of seeing this pattern of results in the same direction we expected. So let me switch gear. That was sort of the density, kind of showing us what we find when looking just at density. And let's, in this, look a little bit more at what we see in terms of proximity. Now, prior systematic reviews and meta-analyses have been more equivocal about the role of proximity. So we were really excited to see what we would find. I'm going to show you our forest plot of the pooled effect sizes by study. So not as many studies about this, and about 103 effect sizes reported. But again, you can see kind of the weight of the evidence towards the right-hand side, towards where a removal of closer retailers would be expected to change health behaviors in a way that would be beneficial to public health. So again, evidence pointing us again in the same direction, that density before and now proximity in this slide should be something we should be caring about in terms of the retail environment. So take that to the separate meta-analyses, and we see proximity, again, a similar to 2.4% relative risk reduction kind of pooled across the studies in our analysis, and consistent with the same pattern and direction of results. So I mentioned that there's a lot of diversity of methodological choices by retailers. And I'm next going to talk to you a little bit about how these results differ based on the methodological choices in the included studies. And I just want to be clear, I'm not saying that there's a lot of pieces going on in these studies. So this doesn't mean that like this one thing is always going to be associated with a larger size, but it was sort of our exploratory look at what seems to be associated with larger or smaller effect sizes, or consistent with the pattern of other things we've seen. So just to orient you on this place, again, every row is a study characteristic, and then you get the direction and the estimated relative risk reduction. So there were very few papers that used activity spaces where you change the calculation of density based on where people go during their day. So, and they made some other methodological choices. That's kind of, I think, the reason why that one stands out. But again, same direction. Longitudinal studies seem to show a little bit bigger of an effect size, but the cross-sectional ones were in the same direction. And then we looked at if people adjusted in their models for individual level, neighborhood level, and both covariates. And the absolute unadjusted models didn't show us very much of an effect, but once you took into account the individual's characteristics and or the neighborhood characteristics, then you got the same kind of direction and pattern of results. So I know I sound a little bit like I'm on repeat or a broken record, as I guess used to say, of saying the direction and pattern kind of is pretty consistent across most methodological choices, just as it was across measures of density and proximity. So now I want to look, one of the neat things about being able to look at the diversity of different studies is we can look at does the same pattern of results hold up by different sort of places or populations or types of people? And the answer is yes, with some caveats. And I think they conceptually make sense. So let me walk you through this a little bit. We see not a lot of studies. There were very few studies that looked at just one or the other gender. So, but still in the same direction there. But what I want to call your attention to is the income or resource level or lack of or deprivation level of the participants in the studies. And so if you look at the estimated relative risk reduction for low income participants, you see that removing retailer density exposure would have an estimated 4.3% reduction in, for example, smoking. But you don't see that for high income participants. So what that sort of says to me is that where there are people with more deprivation or fewer resources, retailer density may matter more. And that makes sense if you go back to our theoretical framework we talked about earlier, because some of those search costs may not matter as much if you have additional resources, you may be able to travel farther, and so on. And then the other thing I want to call your attention to is we also looked at these results, so where they were stratified in the studies by the intensity of use. So we're calling this intensity, and that's sort of how it was measured. Maybe you could think about it in terms of kind of either tobacco use dependence or addiction. That's maybe slightly controversial to say, but thinking about the intensity of use. So are you like smoking a pack a day every day, high intensity use, or just the occasional cigarette, low intensity use? And we see again that folks who are using a lot more tobacco, the role of retailer density and proximity seems to matter more when we're looking just at folks who have higher intensity use. And it seems to matter much less for folks who are just an occasional smoker, for example. So to me, this says our patterns are not the same across all populations. And what we're finding kind of conceptually makes sense, which as the person who did this meta-analysis, I'm really thankful for that it kind of comes through in a way that makes sense and fits with the theoretical framework we kind of were using. So let me just give you a little bit more kind of the other pieces of context. So we looked at different countries where the data came from. We looked at the presence of retail advertising restrictions and retail display restrictions. And basically what I really want to call your attention to, yes, there are some differences in the size of the numbers there, but they're all in the same direction. And the size of the number is a little bit confounded with other study design choices. So really want to focus you on that direction across country, across restrictions, again, seeing that this does seem to matter, and we're seeing this consistent result. So I can now let me turn back, not turn back, sorry, now let me turn to the meta regression results. And again, this is where we used kind of a regression framework to predict the size of the effect from the characteristics of the study. And so again, I'm sort of displaying this as the direction in the right-hand column. So when we saw, I'm sorry, when there were outcomes about relapse, it made the size of the effect get a little bit smaller, and same with young adult initiation. And as I mean, we saw this same pattern in the previous kind of separate meta-analyses. But what I want to call your attention to is in these meta-regression results, we again see some things that make sense, or at least I think make sense, in terms of, I think there may be better measurement of the relationship between exposure and the outcome, or at least the causal kind of piece of it, if in a longitudinal design. So it's kind of reassuring that longitudinal designs are showing a bigger kind of effect. And then it also makes conceptual sense that when people delinearize or categorize or dichotomize some of their exposure variables, that makes the effect size larger, and we're seeing the same thing here. So again, kind of hoping that this is coming through as consistent kind of pattern of, we're seeing what I think we should expect to see in the theoretical framework. So just a little bit more kind of to sort of think about the literature more broadly now that I've presented our results in gory details. So we did look at publication bias. We know that researchers are more likely to publish things with a significant historical kind of way of p is less than 0.05 result. And we know that like bigger findings are more likely to be picked up by journals. And we do see that a little bit when we look at the asymmetry of the funnel plot. So there is some evidence that there's publication bias operating here. My take is that that may bias some of our numbers a little bit, but I still think that pattern of direction of the results is pretty strong. So big picture, if you had to make me take like all of these hundreds of effect sizes across these 27 studies and like boil it all down into one symbol, I would say there is a positive effect, a positive relationship between retailer density and proximity and tobacco-related health behaviors. So that, to me, we're showing evidence that those two things should be connected, including with a solid number of longitudinal studies that are in here. And we can see that across design choices for the studies, we can see that across contexts, and we can see where that matters with different populations. So if you want even more of the gory details and all of the statistics and even more detail, our paper is freely available, open access. You can Google it and download it. And I wish you reading pleasure with it. And so big picture, that's out there for anyone who's interested in more details. Now, I want to recognize that a lot of this literature comes from Canada, Australia, New Zealand, the United States, and the UK. And you may be wondering, are we seeing the same pattern of results in countries with fewer resources or lower income? And the answer is still pretty sparse in the literature, but there's at least some evidence that this pattern that I've just described to you is consistent beyond kind of the resource level of the country. And so there's this great paper of school-based personnel and outlets in 13, I think, countries in sub-Saharan Africa, and we see, or they find rather, the same kind of direction and pattern of results. So I think this is not just we find this in the US and Canada, but this is kind of something that is worth considering and thinking about globally. Now, I do want to raise just a couple other kind of pieces in my last few minutes. that there are, to me, equity implications of this to be considering. And this is probably particularly true in the United States, where we have such divides by racial segregation and income in the way our population is spatially patterned. So we know there is ample documentation that there are more retailers that sell tobacco products in certain neighborhoods than others. And that's really patterned around income and racial composition. We also know there's more marketing in neighborhoods patterned by those same things. So given that retailer density and proximity seem to matter, and we know there's already a disparity in where there are more retailers and more marketing, that's, to me, there's a big equity implication of thinking about this. Like, yes, it matters. The exposure to these retailers and tobacco products and all the other kind of pieces is not the same for the entire population. And that needs to be taken into consideration as we think about health equity and as we think about interventions. And I think this also fits into the kind of, and again, forgive me, this is sort of me in a US context, but thinking about the kind of end game of the tobacco movement, and thinking about the role of the retailer environment. And where I am in the US, I mean, such a ubiquitous product, absolutely everywhere, and it feels very normal. And there may be room there to think about, as we work products and marketing out of the retailer environment, does that get us closer to the end game? But regardless, I think our meta-analysis kind of shows the importance of the retailer environment in driving, or at least to be technically correct, to be associated with tobacco to be associated with tobacco use behaviors, and thus have important implications for tobacco retailers in how we think about the end game. So I know I've just given you a whole lot and some kind of heavy meta-analysis methods, forgive me, but I'm gonna now stop sharing my screen if that's okay, and I'm happy to take any questions.
Wonderful. Thank you, Joseph. That's fantastic. So folks can put questions into the Q&A box, and maybe as you're typing, I will start off the questioning. So can you say a little bit more? I think this is more of a methodological question. When you talked about eliminating tobacco related density in, what exactly does that mean? There's like no stores anywhere, or could you just say a little bit more about that?
Great question, and thank you for helping me clarify that. So the underlying principle of relative risk reduction is you're eliminating an exposure to something. So when you think about what we're doing in our tobacco retailer density papers, a lot of times I like to explain this in sort of a regression framework. So we're saying, does a 1 unit increase in tobacco retailer density influence this behavior? So I am saying we're eliminating the 1 unit increase in that statistic. And that's what the elimination of the excess exposure is. And again, this is sort of the challenge of doing meta-analysis on such a diverse and observational literature, is that we're kind of averaging those together across all these studies. And hence, I really want to emphasize the direction and significance kind of side of this, even more than like, this is not the be all end all of 2.5%. But it's that elimination of the excess density based on the way it's being measured in the studies we're including. I hope
that's really helpful. And then, so from a policy perspective then, and this may be an unfair question to ask, but from your research and knowledge of the field, I mean, is there a number to get to in a particular context? So I know like years ago when sort of the tobacco control policy research was sort of starting, and there was a lot of focus on sales to minors. And I think there was an estimate, well, you need about 90% of the retailers not to be selling to minors to really, have a significant impact on youth use. So is there anything you can say about that with respect to retailer density or proximity?
I also wish I had that like amazing statistic. I mean, I think what these data say are reducing density and making there be fewer retailers near you is just good across the board. And so it's almost, I mean, I think the way I read these data is it's not like there is this perfect threshold we need to get to. It's they matter to health behaviors. And so it's an end game goal really is kind of where this takes us. Now, that's not a very popular opinion in my state of North Carolina. And I have already sort of actually when the news releases came out about this meta-analysis, I already managed to cause a very unhappy editorial in one of our kind of newspapers that's in a historically very heavily tobacco producing town. And it's a new idea here. Like we in North Carolina, people are not really talking about the end game, but I kind of hope this meta-analysis and just thinking about like the more reduction we get in retailer density, probably the better for health behavior is an important starting point to get people thinking about our relationship to an end game.
Right. So every unit decrease will make a difference.
I mean, yes, in a broad strokes, that's kind of what I have. Were we perfectly designed to be able to identify a threshold either? So no. So there could be one out there, and that is a great project for some other research team.
Yeah. So we have some great questions in the Q&A. The first one's about online retailers. And so the question is, how do you approach the density proximity issue when we have so many online retailers, and that it's particularly common for e-cigarettes and other products, so nicotine and tobacco products that we're seeing. So I know your work didn't focus on that, but interested in your opinion.
Yeah, absolutely. A great question, because I think that really the whole ability to use an online marketplace for this really undermines the potential regulations around reducing accessibility and exposure to tobacco retailers. And I mean, I think it doesn't, like, I can't directly tie it together, but I think it matters in the policy sense of the importance of age restrictions on online sales and shipping restrictions on online sales in ways that especially protect from youth access to those products. But I think that's it's a whole nother regulatory kind of can of worms, if you will, of thinking about how we address that, because it's the same a lot of ways. I mean, being able to order something online and have it arrive the next day at your doorstep is reducing the barriers to access. I mean, in the way the underlying theoretical kind of framework is similar for why we should really care about online sales.
Great. The next question I'm really excited to see is from Adami, who's an alumni of Hopkins and worked at IGTC for a while. So really great that you joined us, Adami. So his question is more from the political side of making policy progress in this area related to density or proximity. And so the question is, what are the concerns about pushback on trying to reduce retailer density? And maybe if we flip that question a bit, where do you think the levers are to make progress and to get folks on board with trying to address this issue?
So as I said, yes, I live and work in North Carolina with major manufacturers, and literally tobacco leaves blow across the road during harvest season on my way to work. So absolutely, I am certain we will get pushback on that. And I've already experienced some of it, and I've heard, I think it's a new idea to people. And so that's a piece of the pushback. I mean, my take has always been the more we can denormalize the products and regulate their sales in a more compelling way, that's all pieces in the right direction. And as to how to get around that, I mean, other people are better at this than I am, but I think you have to, I mean, some of this is about, to me, I think the biggest kind of piece is the denormalization of tobacco. Like, it doesn't make sense to tell retailers to stop selling some very normal everyday product that they make some meaningful amount of revenue from, regardless of their profit. Maybe it drives some sales, but we're going to have to kind of take the way people think about this and make it so this is a product that requires some level of protection for youth and the public. And to me, that's kind of that's the angle. I don't, this is me in North Carolina, I don't see this widespread adoption out of altruism or like an easy path to strong regulations that does this for us. I think it's still the long kind of hard work of trying to denormalize products and make them seem less normative, so it's okay that they're not as ubiquitous.
Yeah, right. And I'll just point out, I know California is a long way from North Carolina in many respects, but there are communities in California that have passed laws, ordinances to stop the sale of all tobacco products, which is the ultimate reduction in density and proximity. And I think what I understand that the policymakers were going through is what was in front of them was a ban on flavors. And they're like, well, why are we going to ban flavors and still leave these products on the market? Like, they're harmful too. So it's interesting. And obviously, California has had a long history of denormalization. So it takes a lot of work to get to the point where city councilors are thinking like that, right? It's a long time, decades, but it's encouraging that we do get there.
I should be less pessimistic, sorry, because I also think about North Carolina, and like 15 years ago, I think we have smoke-free bars and restaurants and hospitals, not really. And so it's really exciting. Like, if we think about how that built, I mean, it built from small communities and hospitals and school systems, and even schools adopting policies that kind of built on itself so that it diffused out, and then the policies got bigger, and then we were able to get to state level. So I think you're right to push back a little bit on me that there is some hope there in smaller policy changes kind of leading the way.
Yeah, great. And I think we'll go to one other question. I think this will be our last, I think this might be our last question. Why do you think there was a positive a relationship was not found with respect to youth initiation? That was something that seemed to come up sort of consistently. So can you speak to that?
Great question, and probably a fault of mine in the presentation. So this was all studies of adults, and there are other meta-analyses of youth, and which find kind of what you'd expect to find. So I really think we kept that in there because I almost don't think we should see that much, in this case, young adult initiation. And we saw it only in 1 or 2 studies. So sorry, let me unpackage my answer a little bit better there. So first, there weren't very many studies that looked at young adult initiation. It's not very much power or very much to go on. But second, I think most people in this country and the places where these studies were conducted start smoking at age 13, 14. So they start and have initiated before they reach adulthood. And so we wouldn't expect to see young adult initiation to be strongly related to this because it's kind of not a whole lot's happening there. Like, a lot of it's already happened before.
That makes sense. Great. And if you don't mind, I'm going to squeeze in one more question, and only because you are in North Carolina and you've said it's a major tobacco growing state. and you do a lot of rural related research as well. So I'm going to ask you, but see, so the question is about tobacco cultivation and subsidizing that. And I think this question is more broader about countries, but can you speak to like what have your experience in North Carolina and cultivation, farm workers, and how the state has dealt with these competing interests?
I think one of the things that really helped us in North Carolina, for in some ways at least, is that it used to be there were so many small family farms, and there was a whole price support system and allotments and sort of subsidies. And so whenever the tobacco manufacturers, tobacco industry needed people to come to the state capitol and push back, they could get family farmers, like real, authentic family farmers from legislators' districts to show up in Raleigh, our state capital, and be like, you are destroying my family farm and my way of life. And it was very impactful. So when we lost or got rid of the same price supports, there was a ton of consolidation in the industry, and it went to being kind of corporate agriculture. And they still send people to the state capitol to try and look like family farmers, but for the most part, it's like big agribusiness, and they can no longer get this really authentic grassroots sort of set of farmers to show up in the state capitol. And I think that's actually really helped the policy arena. I mean, I can see the question here, and it is so compelling to sort of just like, let's stop it at the source. Can we just like get rid of the production of the crop to begin with? I mean, I see the logic there. In North Carolina, at least, the political ramifications, it's so much easier to regulate the outside of the agricultural system and to do try to even this hard work on endgame and density reduction is probably a better sell here than sort of banning a important and lucrative commodity crop. That's not very satisfactory as an answer, I know, but
yeah, it's complex. Yeah. but Dr. Joseph Lee, I just want to thank you for an amazing talk. I know we had people from multiple countries join today, and there's a lot of interest in this topic in this country and elsewhere. And you did a great job educating us about sort of the frameworks and how to measure density and proximity, but also some of the findings that you've been able to determine. So just thank you so much for sharing that with us today. It was a fantastic presentation.
A real pleasure, and thank you for the great questions.